perfect stranger, but I caught it in your smile. You had to travel half the world and back just to catch it.
Okay, so this is Dr. Thornley, and this is part 9 of my medical marijuana series. I'm a neurologist subspecializing in epilepsy. I also deal with chronic pain. And today is April 13th, so whatever I discuss right now may be negated by any future studies. So today I'd like to talk about the role of cannabinoids within the tumor pathology. So when I was reviewing the literature, I normally like to review scientific articles. There's a scarcity of scientific literature, primarily in the clinical arena regarding medical marijuana and the cannabinoid pathway within tumors. There's been a lot of information and scientific evidence that it works with reducing the proliferation of cancer cells, but not a whole lot in terms of clinical studies. And many times scientific studies don't always translate into clinical results that are positive. So this is just background, and it can serve as a basis to see whether or not it can also be used with anti-tumor uses. That's probably further down the road, but these are just preliminary. This is just preliminary data to give information that it does have anti-tumor properties within the mouse model. So within the pathway, there's an endocannabinoid pathway, and then you've got CBD and THC. CBD is the non-psychoactive portion, medically extracted from the medical plant called cannabis sativa, and then you've got THC, which has the psychoactive portion extracted from the medical marijuana plant, and its role is has a more potent use in terms of medical application. CBD is non-psychoactive. Low-dose THC in combination with CBD is helpful. It covers a wide range of medical applications, and then THC at higher doses you might start getting into side effects. But CBD has no psychoactive properties. CBD plus low-dose THC has no psychoactive properties, and that's just a recap. And if in case you haven't watched any of my other series, my series 1, 2, 3, 4, and 5 goes over the mechanisms, legalities, application, dosages, ratios, and ways of taking it. So this part of the series will go over the disease process and delve a little bit more of the role of endocannabinoids and how it can potentially help with medical problems. So today I'd like to talk about cancer, anti-tumor effects of the CB1 and CB2 receptor. So CB1 is found predominantly within your nervous system, within the brain, spinal cord, and maybe a little bit within the nerves. I found some articles on that. And then the CB2 receptor is found predominantly within the immune system. But researching the literature, it's also found to be present in other organs, which tells you that it's not just helpful in the brain, but has a potential benefit for a wide variety of conditions. But the other conditions have not been well studied yet. The studies have focused mainly in neurological symptoms because it's very predominant within the nervous system. And as we find things as we go along, more studies are being done on other organ systems. So for the endocannabinoid pathway within for bladder cancer, CB1 is found to reduce proliferation of tumor cells within the mouse model, and then CB2 is found to reduce the inflammatory state, which is necessary for cancer cells to proliferate. In addition, in other urologic types of cancer, so for renal cell, the cannabinoid receptors are found to be less within the renal cell, with renal cell carcinoma, and this is thought maybe to cause an increase in the number of cancer cells. It's thought possibly be related to regulation of cancer cells. So when you have less of the receptors, then there's a proliferation of the cancerous cells within the mouse models. Also, there are two types of renal cell carcinomas. So chromophobe types of renal carcinoma is found to have the same number as a normal kidney cell, and then the clear cell renal carcinoma is found to have a reduced number of CB receptors. So this is actually helpful histopathologically because apparently it's very difficult to differentiate the two. So this might also be helpful in looking at the pathology if you want to differentiate the two types of tumor. Also, in addition, with prostatic cancer, the receptors are found to reduce, so the presence of the CB receptors are found to reduce the proliferation of the proliferation of cancer cells within the prostate when cancer has occurred. And then also with regards to breast cancer, it's found to reduce the viability of cancer cells. It's found to reduce the number of metastatic cells. And then there's also one study that it's found to make the microenvironment less amenable to metastasis. So there are all these scientific studies that show that it's anti-tumor, but that's at the cell level, and these are in mouse models. So I don't know how much this can translate into clinical studies, but everything has to start somewhere. And it doesn't always translate, and that's why more and more clinical trials are needed, more and more studies are needed to see whether or not the basic science can correlate with clinical success. All right, so today that ends my review on a few papers on cannabidiol and the cannabinoid system regarding anti-tumor effects. And this is Dr. Thornley signing off.